So I'm Jasmine Hong, and I'm gonna give a presentation on herpes for Public Health 1. Beginning off, herpes is a sexually transmitted disease. It's an infection caused by HSV, which stands for herpes simplex virus. And it also affects the external genitalia, anal region, mucosal surfaces, and skin in other parts of the body. So herpes exists because it's spread when cells from infected skin come in contact with either broken skin or mucous membranes, such as the lips or the genitals. Oftentimes, herpes is spread through unprotected anal sex, oral sex, and vaginal sex. It continues to exist due to its dormant presence in humans. Herpes occurred, it initially occurred when chimpanzees, approximately 1.6 million years ago, in chimpanzees before the evolutionary split to ancestors of the modern humans. Um, Fun fact, it is actually a study that the chimpanzees or disease of herpes was actually spread because a human man had eaten chimpanzee meat, like flesh. So that's how herpes spread to the human race. Moving on, humans are actually the only primates that have two herpes simplex viruses. So the first one is HSV1, which are sores on or around the mouth. These often look like cold sores or like blistering on the mouth. HSV2 is sores on the genitals, so anywhere on it or even around it, and these can actually be very quite painful and just uncomfortable discomfort. Patients can feel discomfort and uncomfortable with the sores on the genitals. So herpes actually occurs in 2/3 of the population that are under 50 years old. Most people are actually infected with the herpes simplex virus type 1, 67% of the human population actually. So it's primarily found in the Americas, Europe, Africa, and the Western Pacific. The factors are the highest for people in Africa just due to the lack of public health care, and the needs for the people are higher with less people to serve those needs. So, public health problem continued. The risks for the community. Obviously, an outbreak of herpes simplex viruses could occur due to the lack of education on prevention and treatment of the herpes viruses. Risk and transmission rates would remain high without proper treatment. And herpes could spread even more than it already has, which again is already 67% of the US population under 50. So, some etiological factors, and this is from Winchester Hospital. The article was made in 2018. Females and males who are sexually active, so anyone who is engaging in sexual intercourses or anal sex, vaginal sex, any of those, people with multiple sexual partners, just because like people don't get tested all the time, or just when you're having more sexual activities with multiple people, there is a higher chance of getting herpes or other STDs. Not having protection during sexual activities, this is the main one. Many people don't use a condom or dental dams, which is has a big effect. And also having a history of sexually transmitted infections. Sexual intercourse at an early age also contributes to herpes. So, how to solve herpes? This first strategy is education on prevention. So, educating oneself on the risks and symptoms of herpes can help resolve the issue of herpes. Using protection during sexual activities can prevent the contraction of the virus. So, again, condoms and dental dams. Not having sexual encounters while having symptoms present, such as sores or any type of redness, also. The second strategy would be treatment. Currently, there is no cure for herpes, but upon discovering symptoms, going to the doctors can limit the virus's reach because they'll prescribe antiviral medications. So, the second way to solve herpes, cultural example, which was from Canada. Canada solved their epidemic of herpes through educating the public on how to deal and manage with a sexually transmitted infection. Patients are treated over a course of 2 weeks and given antiviral medication to stop the disease from spreading. A historical example would be the American Sexual Health Organization. It's a support group that provides information and allows participants to share their experiences, fears, and feelings. Obviously with other people who have had herpes or been around people with herpes or treated people with herpes. So, public health and herpes in the future. Coming to a conclusion, much of literature indicates about preventative measures on herpes. Upon the discovery of symptoms, it is important to go to the doctors and take antiviral medication. It is also extremely important to abstain from sexual activities until symptoms are alleviated and herpes has fully gone away. In my personal opinion, due to the absence of a cure for herpes and other sexually transmitted diseases, it's extremely crucial to educate oneself and the general public to prevent from outbreaks and hysteria regarding the disease. So, at the end, these are just my references, and I just want to thank everyone again for listening to my presentation. Thank you.